I'm talking to Robert Fox, Executive Director of Oxfam Canada. We're beside the fake lake at the International Media Centre at the G20 Summit in Toronto. I think a lot of people would like to know, Robert, what's actually going on inside the walls of these summit meetings, and what happens there?
Well, Oxfam takes these summits very seriously. We're at each of the summits each year, and we work for many months leading up to the summit, but by the time people have actually gathered in the summit location, what's happening is that there's a debate happening behind the scenes between the various countries that have come together. Some of them have a very clear sense of mandate and responsibility of their citizens to come to these global summits and increase the level of ambition to try and get a stronger, bigger, more clear, and more precise commitment from the communique. Others come here thinking that they need to dodge accountability, dodge responsibility, and they're working to ensure that the communique that comes from the summits is as general and diffuse as possible. And so, we monitor the various drafts of the communique over the months leading up to the summits. We're meeting regularly with the Sherpas, who are the senior civil servants that represent the prime ministers and heads of states in these meetings. And so we're monitoring when we're talking, for example, about funding commitments for aid and development. When they move words from more to better or from new to enhanced, that usually means that it's the countries that are trying to escape accountability and water down their commitments that are in ascendancy. When we actually can sharpen some of that language and have more explicit commitments, that's when we're making progress.
How does Oxfam actually work with these senior bureaucrats to toughen that language, to find out what's happening, to coordinate among the different nations?
Well, as you know, Oxfam Canada is one of 14 Oxfams around the world. We're a global confederation, and so we have advocacy staff who are meeting with the heads of state in many cases, and certainly senior civil servants in every case, in each of the G8 and in fact most of the G20 countries. And we're presenting our evidence, presenting research, working with our partners by providing a platform for women's organizations, farmers organizations, community groups, the poor of the world, to come and intercede directly with those governments to try and press them to live up to their commitments and to invest in the future. We also, though, we have both an inside and an outside strategy. So yes, we're doing research and advocacy, but we're also in the streets. We do that through our media. A number of people have seen the Oxfam big heads that we bring out at these sorts of events to try and bring a sort of a sassy attitude to some of these things, but attract the attention of the media and mobilize public concern to put pressure on that absolute last moment. Because at this point, it's late to affect the outcome of the summit, but it's also important that we affect the expectations around the outcome, because sometimes that means there will be a last-minute push and leaders will come here and do a little more than they were intending to, and when they do more than they were intending to, usually that's better for all of us.
Absolutely. Tell us about Oxfam and maternal health. How is this issue shaping up, and what's your view of Canada's of the action that Canada has pledged?
Well, so for us, maternal health is absolutely central. Oxfam Canada focuses all of our work on gender justice and on women's rights. And so we recognize that it is absolutely criminal that there are 1,000 people dying every day on the face of this planet. And we are absolutely determined that there should be a robust response to this. The response from the Canadian government to date has been quite weak. They've committed $1.1 billion to the Maternal Health Initiative.
Sounds like a lot of money.
It sounds like a lot of money, but as you know, they have spent a larger amount of money on 3 days for this summit itself. So you have the comparison 3 days for the organization of this summit, and you compare that for $1.1 billion for 5 years for our global response to maternal health. So we think that in fact Canada does need to be much more ambitious to commit more funding to this initiative, and to do that clearly they're going to have to raise their level of international assistance. As you know, Canada has capped its financial assistance for international development. It has frozen international development for the next 5 years, and that means that our capacity to grow our level of funding has decreased, and our concern is that we're sort of robbing Peter to pay Paul. If we're not actually growing the size of the pie, then what we might be doing is taking money from children's education to invest in children's inoculations, or from health broadly to invest in women's health. Well, if that's the case, it's a shell game, and it actually isn't achieving the objectives that people have set, and it isn't addressing the absolute requirement for us to live up to the Gleneagles commitments made globally to increase aid by $50 billion. You'll recall.
Well, I was going to ask you about that, because the governments make commitments and then they don't come through on them.
So you recall in 2005, the world leaders came together in Gleneagles, not because they wanted to, but because there was a global mobilization calling for action on poverty. They committed to increase their aid budget by $50 billion, $25 billion of that for Africa. 5 years later, this was the deadline for their fulfilling of those promises, those commitments, and they're $20 billion short globally, $15 billion short for Africa. And so what we're looking for here is an emergency plan from the G8 leaders that identifies how they're going to increase their aid by $20 billion to close the gap in the next 2 years. And we know they can do it. When we look back at the last 2 years, we saw that they mobilized $17 trillion globally to bail out the banks and refloat the economies of the North. And so what we're saying is that sets the bar, and we're going to judge their performance on global poverty against their performance on bailing out banks. There are 1 billion people who go to bed hungry every night in this world. There are, as I say, 1,000 women a day who die in childbirth. There are 70 million children who should be in school who aren't in school. That, to me, is an equal crisis to the crisis that we were facing 2 years ago, and any less robust a response is completely inadequate and indefensible.
Thank you very much, Robert.
Thank you.